Hello, my name is Deneb Edwards and I own Tranquil Harmony Massage, and today I'm going to talk about the Psoas release. And the reason why I'm making this video is because I have clients that come in regularly who complain about lower back pain. And I suggest the Psoas release to them because the Psoas muscle itself comes up and attaches to the lumbar spine, and if that muscle is tight, it can pull on the spine, which can cause lower back pain. And once the spine can't move anymore, then it will start to tilt the pelvis. And I use this technique, and the best compliment I get from my clients is when they come in, they can barely walk, and they get down on the table, I do the psoas release, and after a session they get back up, they get dressed, they come out, and they say that's the first time they've been able to get dressed in months without pain. And it's a very good feeling to be able to provide that kind of relief. So the psoas release that I do, I learned from a manual integrated therapy class that I took from James Wisłowski. And the way we approach the muscle is, instead of coming at the muscle with the fingertips, we're going to come with the flat of our hands on the approach, and then we're going to rotate to the blade of the hand to pin the muscle down. As we do this, the first muscle that we'll do is the Iliacus, and then we'll move to the psoas muscle. And the reason why we do this order is for the client's comfort. It allows them to adjust to what you're doing if it's the first time you're doing this technique on them. So we'll provide proper draping first. What we're going to do is we're just going to take the sheet, and rotate it under here, slide it in like this, and you can pull it tight like that. And then you can tell the client it's okay. You can say, go ahead and grab the sheet here to help secure the blanket, and it makes the client feel more comfortable. They have control over the sheet. For this demonstration, I'm going to pull the sheet to the side a little bit more so that we can see what's going on. Now, it's not uncommon for the clients to have their underwear on or even a pair of shorts on. And the way you're going to approach the client is you say, all right, so where the muscle's at is it's just on the inside cup of the hip. And what I'm going to do is I'm just going to pick up their leg like this and then use my whole arm. That way I just stand here, and it takes less strength to hold the leg upright. Then we're going to come onto the client's hip, and we're just going to go, all right, so we're coming over the cup of the hip here. And again, flat of the hand until you get to the point that you want, and then you're going to rotate to the blade of the hip, or the blade of the hand. Now we've got the muscle here, and the way you can check the muscle is you can have the client lift their knee towards their chest. Go ahead and relax. And that's all it takes, just a little bit of movement, and you'll feel the muscle jump right out at you. So again, this first muscle that we're working on is the Iliacus. And the way we start is we're just going to gently rock back and forth. We're going to have the client take 3 big deep breaths and focus on their hips. Just let their hips relax. And I'll often tell them, let your hips sink into the table. We're going to gently rock the hip, and then we're going to set the leg down. And we're going to have the client straighten their legs out. And as they straighten out, I'm going to rotate my hand to the top of the leg here, and I'm going to shift my body here so that I can pull with my body against the Iliacus muscle. And we're going to press here, and what that causes is kind of a spreading stretch on the Iliacus muscle. Now, as we get here, we're going to have the client dorsiflex their foot, so we'll tell them to point their toes towards their knees. And then we come here, we hold this for a couple of seconds, and then we're going to reset. We're going to pick the knee up. Now, our hand is in place, so we'll just leave the foot on the table this time. Again, we're going to rock into it. We're going to go a little bit deeper into the muscle. Have them take their breaths. And then we're going to rotate, push on the thigh, have them straighten their leg, do that spreading movement, pin the muscle, stretch, dorsiflex the toes. Now, do that on the Iliacus. The next approach is I'm going to come in and pick the leg up again. So in order to find the psoas muscle, we're going to slide the hand along the edge of the hip just a little bit, and you'll come to the inguinal ligament. And right there that's the easiest place to find the psoas muscle. And again, you can check and see if you're on the right spot. And what you're going to have the client do is they're going to have cross their knee over to their other leg. Perfect. Go ahead and relax. And oftentimes when you say go ahead and cross your leg, the client will rotate at the knee like this, and that won't work. You have to say, okay, go ahead and cross your leg over to the other leg. There we go. And again, you'll feel the muscle jump right out at you. We're going to have the client breathe, rock back and forth, rotate into the leg, and then you'll notice when I'm rocking with the pinning hand as well, and that just helps settle the muscle, let your hand pin deeper into the muscle. Set the foot down, same process, we'll straighten the leg out, rotate, spread and pin the muscle, push on the thigh, dorsiflex the foot, and then we'll come back and do it one more time. Foot on the table, relax, breathing, and then we'll finish off here with the stretch. And flex the toes. And as I finish this up, what I like to do is just come in and gently rock back and forth on the inside of the hip on the iliacus, and just rotate the head of the femur a little bit. And where I do this at in my routine is I do the psoas release, and I'll come here from this position and work on the front of the leg, go to the other side, perform the psoas release, work the front of the leg, and then continue on with my massage from there. And you can just undrape, same way you started. And that is how we do the psoas release. If you like my video, go ahead and like it and subscribe to my channel for more videos, and leave comments if you have any questions. And if you have any videos you'd like me to do, leave comments and tell me which videos you'd like to see. Thank you, and see you later.